Now, y'all keep going and dancing all around, not you, Dr. Burgess, but everybody in this institution keeps dancing around the fact that there are people that don't have any money. There are people that don't have a job. There are people that don't have any ability at all to get any kind of insurance. And going low under the radar in this particular process that we have continued to deal with, and I have said repeatedly on the floor and in this committee and in other committees, that we should never say the words Medicare without saying the word Medicaid. Now, I visited lots of my friends over the course of years who wound up bankrupt because of medical conditions, and evidently y'all haven't had that happen to anybody. I've visited many of my friends that wound up in nursing homes on Medicaid, and yet I have a governor in my state and the state of 3 others of us who wouldn't even expand the Medicaid program. So you help to create the problem, and then you turn around and say there's a problem that I don't want to fix, and then I guess my ultimate question to you is, where's your plan? And where is the plan of the Republican Party? I saw Mr. Scalise here, and I thought he did a very good job in responding to me when I asked him that question. He said he had a plan, and he enumerated it. He outlined it. So I checked the other day, as a matter of fact, I checked today about whether or not the 200-plus Republicans had signed on to the Scalise plan. No, 104 are co-sponsors at this point. Now, all I say to y'all is you just keep going around beating up on this particular situation. You've done a good job. You've poisoned the well. You have governors. You have an echo chamber that has done everything that it can to make sure that people in this country don't get health insurance, that this president and people like me who would have preferred single-payer and universal health care would have much preferred that that be the case so that everybody in this country, even if it means me paying more, everybody in this country would have access to affordable health care. And let me end by saying to you, Dr. Fox, saying that people don't have credibility. She's not here. Tell her in my absence, or her absence, what I said. I hope that she would be here. Saying that people don't have credibility is not constructive in the legislative process. Ms. Slaughter has pointed it out. Mr. McGovern pointed it out, and I want to continue it. I will disagree with you about a lot of things, but I will not call into question your credibility. Now, this president won his election by 5 million votes, and he won his election after the passage of the Affordable Health Care Act, which to a relative degree could be argued that it was at least the same mandate that any other president had because he got elected. We may be glum today as Democrats. We're not in shambles. I certainly am not. I have a fundamental disagreement with many of you in this room with reference to our responsibilities to each other. I want everybody to have what I have, and I want everybody to have good health insurance. And I defy anybody to tell me that that isn't what they believe. And if you believe it, then you evidently do not believe it well enough to have offered a plan that's the alternative to the Affordable Health Care Plan. What you've done is vote on it now, coming up soon, 46 different times. And you've done an effective job in making it something that looks like the so-called American people. That means 40% of y'all don't want it, when 40% probably do want something. In time, we will come to know that it is better for us to avoid people having financial ruin. It's better for us to have people not be denied coverage because of minor pre-existing conditions. It's better for men and women to pay the same thing for their insurance. It's better to have people not have their insurance dropped at the whim of an insurance company. And there were people that were being dropped from insurance before the Affordable Health Care Act, and I might add in great numbers if you go into it and you look at it. So I said you'd hear me now. The question is, can you hear me now? I don't like what you all are doing, and I don't think it's right. I think what you ought to be doing is fixing. And for my friend from Oklahoma, who I have great respect for, it is that even if the president were to walk in the room and start to talk about let's sit down and fix the Affordable Health Care Act, There ain't nobody on the Republican side that would work with him. And you've evinced that more times than a little bit, not only by your actions, not you, Mr. Cole, but many of your colleagues have made it demonstrably clear that there's nothing that Barack Obama can do that satisfies their requirements. That is unfortunate. I didn't feel that way about President Bush, and I fundamentally disagreed with most of the things that he offered. But I had an opportunity to work with him as you have an opportunity to work with Barack Obama. And so when the deal goes down, it's a dark day for America when we, as their representatives, can't find common ground and can't find reason enough to do the things that are reasonable. If we have to scrap this one, then I want to see the one that you're going to replace it with. And I promise you, I'll work with you if you're going to help me to get those 40+ million Americans who are uninsured insured and have an opportunity to the same access. Otherwise, just keep on paying because they're going to keep on coming to the emergency room. It's just a matter of time.